If you've ever experienced the torment of itchy rashes, stubborn eczema flare-ups, or any kind of skin inflammation, you might have come across a little tube of magic called cortisone cream. But before you slather it all over as the answer to your skin woes, let's dive into everything about this seemingly humble the counter superhero.
Let's break it down. Cortisone cream is a topical corticosteroid. Think of that as a medicine that mimics cortisol, a hormone your body naturally produces to fight inflammation. In the world of skin, inflammation is the root of a lot of troubles. Hydrocortisone, the most common type of cortisone cream you'll find over the counter, is hydrocortisone. It's your go-to for those minor cases of itchiness, irritation, and redness. Prescription strength. Feeling like your skin needs a bit more. Doctors might prescribe stronger cortisone creams when over-the-counter versions aren't cutting it.
Imagine your skin is having a rowdy party with red, angry, inflamed guests. Cortisone cream is like the calming friend who comes in and tells everyone to chill out. It works by taming your immune system's overreaction, soothing that inflammation like a boss.
Here's where cortisone cream truly shines. Eczema and psoriasis. When those chronic skin conditions flare up, cortisone cream can bring much-needed relief from itchiness and redness. Dandruff. Yes, even your scalp can get inflamed. Cortisone cream sometimes helps soothe a stubborn case of itchy flakes. Diaper rash. A little one's sensitive skin savior cortisone cream can help ease the discomfort of diaper rash. Bug bites. Reduce the swelling and relentless itch of those pesky bug bites. Poison ivy, oak, and sumac. Itching relentlessly. Cortisone cream can offer some relief from these allergic reactions.
Now hold on before you become a cortisone cream-spreading enthusiast. Like any medicine, there are some important things to keep in mind. Consult your doctor. Is this your first time with a skin condition? Is it unusually severe? Get your doctor or pharmacist's advice before reaching for hydrocortisone. 7-day rule. Over-the-counter cortisone is for short-term relief. If things haven't improved after a week, it's definitely time for a doctor's visit. Possible side effects. Yes, even our skin superhero has a slight dark side. You could experience thinning skin, dryness, or sometimes even allergic reactions. Don't fight infections with cortisone. If you suspect a bacterial or fungal skin infection, cortisone cream will not help. Those need specific treatment. See your doctor.
Okay, you're ready to use it, but how? Here's the lowdown. Clean hands are key. Before touching your skin, wash your hands thoroughly. We don't want to add any unwanted guests to the skin party. Targeted application. Apply a thin layer of cortisone cream only to the affected area. Think precision, not all over-slathering. Gentle does it. Rub in the cream gently until it's fully absorbed. No need to get aggressive. Frequency matters. Follow instructions on the product or your doctor's advice on how often to apply it.
Did you know cortisone cream has uses beyond just treating skin problems? Here's where else you might see it in action. Hemorrhoids. Yes, some over-the-counter hemorrhoid creams actually have hydrocortisone in them to relieve inflammation and discomfort. Other uses. While less common, doctors might occasionally prescribe cortisone cream for other inflammatory conditions after careful consideration.
So, should you always have a tube of this stuff on hand? Like most things in life, the answer isn't a simple yes or no. Here are some things to think about. When it's a lifesaver, minor, occasional itches or rashes, got a mosquito bite or a random patch of itchiness, cortisone cream can absolutely be your temporary fix. Treating known conditions under advice. If you've been diagnosed with eczema or psoriasis and no cortisone cream works for you, it's a handy tool in your skin care arsenal.
When you should pause. New or worsening symptoms. If your skin problem is new, severe, or getting worse, Despite using cortisone, it's definitely time to call in the professionals. Long-term use. Remember, cortisone cream is meant for short-term relief. Prolonged use can have side effects, so it needs to be done under a doctor's guidance.
Let's bust some common misconceptions about this little tube of wonder. Cortisone cream is addictive. While you can develop a dependence on it if overused, cortisone in topical creams is not addictive in the same way some medications can be. Cortisone cream thins your skin permanently. Used correctly and short-term, it does cause some temporary thinning. Usually, skin returns to normal once you stop. However, prolonged overuse can lead to long-term changes. Cortisone cream can cure any skin problem. Sadly, no. While it's great for inflammation, things like bacterial or fungal infections need entirely different treatments. All cortisone creams are the same. They vary in strengths. Hydrocortisone you find over the counter is relatively mild, while prescriptions ones can be much more potent.
Ultimately, using cortisone cream is a personal decision. Understanding how it works, its limitations, and potential side effects is key to using it wisely. Here's a recap to help you decide. Be a self-advocate. Don't just blindly apply it and hope. Communicate with your doctor or pharmacist, especially if you have other health conditions or take medications regularly. Respect its power. Cortisone cream is potent medicine, even over the counter. Use it responsibly and according to instructions. It's a tool, not a cure. Cortisone often gets the inflammation and itch under control, but it might not address the root cause of your skin troubles.
So is cortisone cream a miracle or a mishap? Like many things, it depends on how you use it. If you struggle with the occasional skin flare-up and understand it's a temporary fix, it can be super helpful. But if you have chronic, serious, or mysterious skin problems, your best bet is partnering with a medical professional to find long-term solutions. I hope this video gave you a deeper understanding of cortisone cream. Hit that like button if it was helpful and share your experiences and questions in the comments below.